Hello, everyone. Welcome back to Public Health Modernization Chats. I hope you all enjoyed a little bit of a more calmy, moody ease into our meeting this morning. It was very reflective for me of the weather that I'm currently experiencing here in Portland, Oregon. And we're excited to have you all here with us today. For those who do not know me, my name is Heather Redman. I use she, her pronouns, and I'm the Strategic Initiatives Partnerships Coordinator within the Public Health Division at OHA. And I am your host, facilitator for this meeting. And today we have an amazing team who's come to join us and present on their program. We've got our WIC folks, our women, infants, and children folks, who are going to introduce themselves here in a second. I'll pass it off to them, and we can get going because there's a ton of awesome information that they are going to be sharing with us today. So, Jolene, if you don't mind, I'll pass it to you, and if you can make sure that you and your team get a chance to introduce yourself to folks, I will get ready to share screen once you're done with introductions.
Sounds great. Thanks so much, Heather. Good morning, everyone. I really appreciated that music. It was just a little, right? As we move into fall and with the world. My name is Jolie McGee. I use she, her pronouns, and I am the Wiccan outreach and integration strategist for the State WIC program. I think, yeah, let's go ahead and have everyone else introduce. I was going to have them introduce before they did their pieces, but let's go ahead and do those introductions now. Maybe I'll pass it over to you, Julie, and then Perla, and then Lauren to introduce yourselves. Thanks.
Wonderful. Good morning, everyone. I'm Julie Reeder. I am the manager of the newly formed WIC integration team, which has data and evaluation, project management, outreach, communications, and publications as well. So very happy to be able to come and talk with you today about WIC. And I'll pass it over to Perla.
Hello, my name is Perla Castillo, and I'm a registered dietitian and also the bilingual nutrition consultant at the state. And I'll pass it over to Lauren.
Hi, good morning, everybody. My name is Lauren Simmons, and I'm also a registered dietitian and nutrition consultant.
Great. I think that's it, Heather. If you want to go ahead and get the slides up, we'll go ahead and kick off our presentation. So great. Let me just say before we get into this, I want to say why we are here today. I do want to recognize that you may have heard we are in a government shutdown, but I did want to reiterate that WIC is open for business and that we are continuing to serve families, and families are able to access their benefits. You may have some questions about this, and we do have a section in this presentation to address what's going on. So that big elephant in the room, we will address that, and Julie will be happy to answer some of your questions. We are limited in the information we are able to share, but we are happy to address that in just a bit. So we did want to let you know we are here, we are serving families and supporting community. We also want to encourage you to continue to send eligible families to WIC as we are open for business. And then another big reason we're here, this is the Modernization chat webinar. We are always striving to meet families where they are, and we have modernized some of our WIC services to better support Oregon families. And two of those areas are around, we are offering new foods and more choices for our WIC participants, which we're so excited about. Oregon is one of the first states in the nation to kind of implement these new foods, all of them all at once. So happy to share about that. And then also about a new nutrition education online resource that we are also going to talk about. So without further ado, if you want to move on to the next slide, I'll go ahead and kind of kick us off. So as we move into this, WIC is recognized as a highly successful public health nutrition program serving Oregon families. We've been doing this for over 50 years. And our vision for Oregon is that we want to ensure optimal nutrition and lifelong health for every Oregon family. You know, not just our WIC families, but for every Oregon family. And that's why you as partners are so vital to referring participants to our program and connecting with WIC so we can make sure that we're reaching everyone. So let's go to the next slide. Oh yeah, that's me. What is WIC? I'm assuming a lot of you already know, but it's good just to kind of hit these. I'll go through these fairly quickly. WIC is the Women, Infants, and Children program. We are federally funded and we are administered through the Oregon Health Authority, the Public Health Division. We support pregnant people and postpartum individuals, those who are breastfeeding, and infants and kids up to the age of 5. We also serve dads. We don't serve them, but we can, any dad or grandparent or foster parent that has a kid under the age of 5, we encourage them to enroll in WIC as long as they meet those income guidelines. So next slide. Our core services are nutrition-focused education. We offer classes in person on how to feed your picky eater, how to cook healthy on a budget. There's a wide range of classes, breastfeeding and so many to list, but we also offer those online classes as well. And Lauren will talk more about this later. We provide a lot of breastfeeding and lactation support. Our goal really is to ensure that that families are meeting, we're able to meet their infant feeding goals. We do a lot of referrals to health and social services. You know, WIC sees this as a wraparound. We are a wraparound program where we are really connecting our participants to other communities in the community. And then we also offer a monthly supplemental food benefit. As you can see, there's a card there in the lower right image that shows what that card looks like, and participants can get a nutrient-dense tailored food package. So who is eligible for WIC? WIC requires that people show they live in Oregon, that they have income at or below 185% of the federal poverty level. That is a family of 4 of about $59,000. And show proof of identity. And then they also need to be pregnant, postpartum, breastfeeding, or a kid under 5. So, and then our reach, WIC has significant reach. Last year, we served over 114,000 participants. We are reaching folks in rural Oregon as well, and 2 out of our 5 pregnant women in rural Oregon participated in WIC. And then our families are trying to make ends meet. And the most of our families, 72%, are working families. WIC really strengthens community. This is a pretty full slide. I apologize for that, but I wanted to just highlight that we really are a critical food security program, and we improve access to local and healthy food. We help to boost that local economy and help those local farmers. Last year, over about 64 million was spent in WIC food benefits. So that's federal dollars coming into the state and being used in local communities and grocery stores. 492 stores and pharmacies accept WIC. So that's where our participants can buy those, their foods. And then over 600 farmers participate in our Farm Direct Nutrition program. Every year, participants get vouchers that they could spend at their local market. And last year, 788,000 was spent by WIC families at markets. And that was about I think it was about a 12 or 13% increase from the previous year. WIC really promotes a healthy community by reducing those healthcare costs, and it operates efficiently. Less than 10% of our program funding goes to administrative costs. So a lot of times when you hear about WIC, you hear about SNAP. And I just wanted to highlight how WIC is a little different from other food programs. WIC is that public health program with a real emphasis on prevention, focusing on health outcomes. We offer a supplemental prescribed food package. We have a real strong emphasis on nutrition education and breastfeeding support. And we have that social history with participants. If we have a pregnant woman that comes in and enrolls in WIC and then keeps their child on until 5, we could be with that family for 6 years. And we see those families from 2 to 4 times a year, depending on just so we see them pretty frequently. And so we really build these relationships and rapport and build trust with these families. So that was that really high level, quick overview of WIC. Are there any questions? I haven't looked at the chat, but any questions about sort of that base level on who's eligible, how to participate, and all that?
Jolene, I don't see any questions in the chat just yet, but as the presentation moves forward, I'll go ahead and raise my hand if there's one that pops up as we continue to learn more. But I'm not seeing any just yet.
Okay, that's perfect. Thank you. Okay, I think we can go on to the next slide, and I am going to bump this one over to Julie.
Okay, good morning, everyone. I have one slide here since it's always evolving to talk about what is happening at the federal level. As Jolene acknowledged right up front, and we'll acknowledge again, we are in a government shutdown. I've been in WIC for 24 years, so this is not my first shutdown. So just letting you know that this does happen. Unlike some other benefit programs, WIC is not an entitlement program, and so we're subject to appropriation. So this does occur from time to time when we do have a government shutdown. As Jolene said, the WIC clinics are open and benefits are absolutely active. And we have been putting that message out to WIC participants via the WIC app. There's a banner ad stating this. We've also been in constant communication with our WIC local agencies to let them know this as well. And I think very importantly, all of our WIC vendors. So all of our grocery stores should be aware that they should still be accepting the WIC EBT card and that benefits are still active. Programs like WIC don't, run out of money right away, and we have funds to at least keep the program going through mid-October. We are monitoring things very closely. We are in constant contact with sort of federal sources. We are in connection with the National WIC Association, which is advocacy organization, and really talking and communicating. So again, there are some procedures and there is funding to carry the program at least through mid-October. If you know someone who has farmers market vouchers, our WIC and Senior Farm Direct programs, those were funded by the 2025 year. So there's still money for those. If you have someone who's holding on to those, or if you're a farmer or connected with farmers who are wondering about that, that wouldn't be impacted. So I think the most important message to get out is WIC is open. Come in for your appointment. Feel free to use your benefits. And if you're a grocery store or farmer, feel free to receive those benefits and they will be paid. We will be communicating, every step of the way to make sure that everyone knows what's happening with the WIC program. But I want to reassure people because I know this is it's a hard and scary time, right, for many. So just WIC is open. The other question I often get is what happened with WIC and HR1, the big, beautiful bill. Beautiful. And so I know that there are big changes to SNAP and there are changes to Medicaid, but WIC really is not impacted by HR1. So I want to assure people that at least at this time via HR1, there aren't significant changes like you're seeing with Medicaid or SNAP. Certainly, we understand the importance of this. We recognize that we're a supplemental program and we work in synergy with SNAP. And of course, people keeping Medicaid is very important. So we are monitoring that as well. The Child and Adult Care Food Program, which funds meals for many kids at preschool programs. We're working with our Head Start partners all the time. Jolene and I just met with our Head Start liaison this week. So we are very much thinking about how this all comes together as a system to really support our families. So I just really want to acknowledge that we're watching everything from every angle and thinking about how we can support. And we promise transparent and timely communication to let you know what's going on with that. Finally, I'll also mention MAHA, the Make America Healthy Again plan. Looking at that, I'll say that largely it is complementary to WIC and the WIC food packages, which you're going to hear a little bit about. And there is a statement in there. I haven't seen anything else come forth about working with WIC or other programs to increase breastfeeding. So as a state with some of the highest breastfeeding rates and the lowest disparities in breastfeeding, I think that's wonderful. Again, that's a statement, but we'll see what comes forth, if anything. So I hope with that you have a little better sense of what is and what is not happening with WIC from the federal perspective at this time. I'll pass it over to hear some more things about that, but we're happy to answer more questions as we can at the end. So thank you for the time, and I will pass it on. Next slide, Heather. Thanks.
Thank you. So again, my name is Perla, and I will be talking to you about our healthy foods package, our new foods, more choice. Next slide, please. Perfect. So at least every 10 years, USDA is required to conduct a scientific review of the WIC foods packages and update them. This assures that they reflect the nutritional science, public health concerns, and cultural eating patterns. The 2024 final rule revision is grounded on evidence-based recommendations from the National Academies of Science, Engineering, and Medicine, and the Dietary Guidelines for Americans 2020 through 2025. As Jolene mentioned, a little bit about us and the community impact. When WIC increases choice and options for our WIC participants, it also improves food access for the whole community. In response to these new regulations, food companies have improved their food products to meet the WIC eligible nutrition standards. Next slide, please. So the final rule updated the nutrition criteria. The criteria is very lengthy, but I can put a link in the chat if anyone is interested in clicking through what that might be. But they updated the nutrition criteria of what makes WIC eligible foods. This slide, you can see all of the different food categories that we conducted a food review process for. So the federal government gave us criteria. We updated what this might look like. We contacted our food manufacturers and requested food product information of all of these various foods. We reviewed about 1,500 different food products. This included also a variation in package sizes, as that was new with this final rule. Before we are able to add a food to our WIC eligible foods for Oregon, we also compare product prices and we conduct a product availability across the state of Oregon. This assures that all of our participants statewide have about equal access to these new foods. Next slide, please. This is a picture of what our updated food list looks like. This went into effect July 1st. And as Jolene said, Oregon was one of the first states to implement this, so we're very excited to be able to bring this to our participants. So our new food packages offer nutrient-dense foods. We offer a variety of foods that are rich in vitamins and minerals, which our participants' diets usually lack. And this includes fruits and vegetables, whole grains, whole grain products, which was new, or an increase of products, which is what was new. We also offer cheese, including string and sliced cheese. Eggs. Eggs are now able to be white or brown. We also have peanut butter or beans. We have cereal, juice, canned or pouched fish, milk options, tofu, yogurt, infant cereals, and infant meats, as well as infant puree fruits and vegetables. And organic options are also available through participants' WIC benefits. So each WIC participant is issued a standard food package with these foods. There's a slight amount variation depending on our participant categories. Next slide, please. So our new food packages offer a permanent higher fruit and vegetable benefit that was indexed to be adjusted each year for food cost increase. So that gets adjusted per inflation. And with the fruit and vegetable benefit, something new is that our participants may now purchase herbs as well. We also increased the variety of the whole grains that we offer. We added 12 new whole grains. We are also increasing our options for whole grain products, and we added a new category of gluten-free options. We also added canned fish to all of our children and adult food packages. And fish may be canned or pouched, as we saw in the previous slide. And our food packages can be adapted and tailored for allergies, cultural food patterns, and special diets, whether that's dairy-free, vegetarian, vegan, or participants prefer to buy organic. This final rule really gives emphasis on our participants being able to tailor their food packages. And so if someone has a peanut allergy, they may substitute that out for a nut and seed butter. If they would like a milk alternative, there's some available substitutions there, and tofu is also a substitution for dairy. So we're giving our participants a little bit more involvement and a say in their WIC foods. Next slide, please. There was also changes to our infant food packages. So the total benefit of jarred baby food, fruit, and vegetables is 128 ounces for all of our infants, regardless of if they're breastfeeding or formula feeding. Our infant fruit and vegetable cash benefit may now be issued at 7 months versus 9 months, so sooner. And what this means is that our participants are able to swap out half or all of their jarred baby fruit and vegetables for a dollar amount. So if they choose to substitute half of their benefit, they still get 64 ounces of jarred fruits and veggies and an additional $11 to buy fruits and vegetables. Or if they substitute all of their 128 ounces, then they will receive $22 to go towards purchasing fruit and vegetables for their infants. Our participants may also individually tailor the formula amounts that they're receiving in the first month. This was new for our partially breastfeeding infants. And this is great because it allows us to support all breastfeeding needs for those infants and also for their our breastfeeding adults linked to the infant. Next slide, please. So we created a new Foods More Choice video as a way to inform our WIC participants of all of the changes that were coming to their food packages. We used this video to also give them a reminder of how to use the WIC Shopper app, and specifically focused on scanning food products to be able to help participants identify what foods are now WIC eligible. With the support of our local agencies and our texting platform called Teletask, we were able to get this video out to participants and also ask them to give us a response of what they learned after watching this video. I can put this video in the chat as well. And if we have time, we can look at it at the end. Do that right now. And as a response to watching this video, our participants gave us some responses back. And you can see on the slide, they learned that more fruits and vegetables have replaced juice, and they were excited about that. They love the fact that we made fresh herbs available. They also were excited to purchase whole wheat English muffins and more produce instead of the juice. And also excited about being able to purchase canned fish. They're excited to try new whole grains like wild rice and almond and sunflower butter. And then the last bullet I like, they said, I think WIC has gone above and beyond with the new additions to the whole grains, peanut butters, herbs, and fish that will allow in July, as well as allowing WIC users to trade items. I'm also grateful the juice funds will be decreased and go towards fresh fruits and veggies. Thank you for helping me and my kids. So we got some great responses from our participants about all of these changes. And we were also able to interact with them through our texting platform. Let me put this in the chat and we can go on to the next slide, please. So this is a fun slide. We got some data within the first 2 weeks that we launched. So for the first 2 weeks of July, we got some redemption data. And as we saw, participants were excited about herbs. So this just shows that they were really actually excited about herbs. And within those first 2 weeks of July, they spent over $8,000 on herbs alone. So that's really cool to see. We also have a little competition going on of what herb was the most redeemed. And cilantro won by over $7,000. Parsley came in second place and basil came in third. And also nice to see on this slide is that within those first 2 weeks of July, our Oregon WIC participants spent over $1 million on only fruits and vegetables, which is really exciting to see. Next slide, please. So I mentioned that with that shopping video, we also reminded our participants how to use our WIC Shopper app. This is a snapshot of what our WIC Shopper app looks like. Like I said, participants are able to scan food product barcodes to see if it is a WIC eligible food. If it isn't, participants are also able to communicate that to us through a feature of why can't I buy this? So it's a really nice tool for us to stay engaged with our participants. And then our WIC Shopper app also gives us some metrics. So this slide is showing metrics for the month of July. On July 1st, which was our launch date, we had we had over 21,000 users on the app, which is significantly more than what we usually do on the first of the months. Sometimes it's around 18,000. So 21,000 was a nice increase, and participants wanted to see what those new foods were and also scanning which products were available. So the very last row of numbers, you can see that unique items scanned. Our participants uniquely scanned 130,000 products. And then for the entire month of July, they scanned almost 500,000 products. So this is just, again, really exciting to see that our participants are using tools to help them identify WIC eligible foods, which is very important with all of these new changes that came to them recently. And I will pause to see if there's any questions. See a comment in the chat. Love the flexibility with the new items that we added. The app and the card were amazing when they were added. Thank you for your work. Yeah, we're really excited to give participants that flexibility as well. Okay, we can move on to our next section. Thank you.
Oh, great. Awesome. Thanks, Perla. Good morning, everybody. I'll pop my camera on, but sometimes my internet is a little bit fussy, so I might turn it off if it gets glitchy. Like I said, my name is Lauren, and I am our nutrition education lead for the Oregon program, and I'll be talking about our new online resource. So next slide, please. All right. We are always looking for ways to modernize in WIC. And so this is our very first nutrition education website that we just launched in early August to our participants. We're pretty excited about that, so I'll be sharing today. As Jolene mentioned, we have touch points with our participants at least 4 times a year. And during those certification and recertification appointments, we like to have what's called a quarterly nutrition education appointment. And this is one of the resources that we are offering to our participants. So it is a new electronic resource for families with evidence-based nutrition education. All of the information that is on the website is evidence-based. We also went through a pretty extensive review process. So we had a group at the state that went through every single web page to make sure that the information was correct and accurate for our families. So participants are able to use this resource as a nutrition education contact to get 3 months worth of their benefits, or just for informational purposes as well. The website is available in 9 languages, including English. So we took our top languages that our participants are speaking, which include Spanish, Ukrainian, Russian, Chinese, Vietnamese, Arabic, Dari, and Somali. The web pages are mobile friendly because everybody has a cell phone these days, and most people are looking at things on their phone. So that was really important to us to make sure that participants could easily access this information on their phone. The website is also publicly available and does not require a login, which is really great. Some nutrition education websites require participants to create a username and password. And we all have a billion of those. And so that can be kind of cumbersome, and you forget your password and have to get it emailed. So sometimes that does limit participants from going in and completing lessons. So this was really great that they're able to just go to the URL, pick a page that they're interested in, and be able to get their benefits that way. Links can be texted to the participant directly from the website as well, which I'll show you in a minute. Next slide, please. All right, so I do have the website here on the slides, but I'll also pop it into the chat. Anyone can benefit from this nutrition education, like Jolene said, grandparents, other caretakers, and parents. Everybody has access to this evidence-based information. Our topics include nutrition for pregnancy and postpartum, infant feeding, breastfeeding, nutrition for children, and then tips for partners and other helpers. So Heather, if you don't mind, I'm going to go ahead and screen share. And let me get our website pulled up. Let's see. Okay, are you all seeing the website? Great, thanks for those. Let me All right, so this is our home page, and as you can see, we have all of our languages available in this drop down, so super easy for participants to just come over here and select the language that is best for them. We have our women, infant, children, and father series. So I'm just going to go ahead and click on a couple of these and just kind of show you what the website looks like. So in our women's series, we have tips for healthy pregnancy as well as health tips for new moms. And so I'll show you, we have this little share button here. So if you click on this, um, you can send the link to this web page by email or text message. So when participants are in their appointment, it's super easy for WIC staff to just enter their phone number or email and just send them the link automatically. So that's super exciting, really easy. Our WIC appointments are pretty jam-packed, so that is a really great, easy way for them to get the information. We have a bunch of different topics, prenatal care. We talk about serving sizes, and then each of our web pages also have sample menu ideas with portion sizes. So that's exciting as well. We have some snack ideas. I'm just gonna kind of quickly scroll through. But we love that there's lots of colors, really great pictures. We have a couple sections on breastfeeding. And then over here, if participants are just interested, for example, they want to know about breastfeeding, these links can also be shared directly to participants as well. So when they click on it, it takes them immediately to this section of the page, so they don't have to scroll all the way down. Go back out. We'll check out our infants. So we have an infant feeding guide, birth to 6 months, and then 6 to 12 months. So lots of really good information about infant feeding. The other cool thing about this website is that there are some accessibility features. So if participants have dyslexia, there's a way that they can put on a filter that makes it easier for them to read. All of the colors are easy to read if participants maybe are like colorblind or have some other vision issues. So that was something that was really important to us as well. We have our child series that goes from 1 to 5. So we can just kind of take a peek at that. Again, we have those sample meal ideas with portion sizes. And we also have our dad series. So we've got Dad's Guide to Newborn Care and then Dad's Guide to a Healthy Child. So we're super excited about this resource. We've gotten a really good response from our local agencies. I get little metrics every month, and the views on the website is getting more and more. More participants are accessing it on their phone. So it's just another great resource for participants to get some information and get their benefits in our virtual world. Okay, go ahead and stop sharing. Any questions about that? And I'll pop the link in the chat. Great. Great. Thanks, Heather.
Jolene, I just want to check on time. I know that there's a few more slides, and I'm sure that there'll be folks that'll have some questions. Would you like me to continue sharing slides to finish the deck? Or would you like to kind of open it up to the room?
We can go ahead and open it up if you like. Yeah.
Okay. We also have an announcement. That was a really bad segue. An announcement from Dolly about a special edition chats that's coming up. And so I want to make sure I leave time for processing, chatting with the presenters, and to make sure that that announcement gets made as well. So Dolly says she only needs 1 minute. That's amazing. We'll pop it over to you in a second, Dolly. But yeah, thank you so much to the WIC team. This was a lot of information that I thought I knew. I thought I was very knowledgeable about WIC, and this made me realize that I am not, and I have more learning to do. So that was great. And I know that we actually have a couple people here, and I won't call you out by name, but we have a couple people on this call who are involved in nutrition, who are involved in food. And I'm wondering if anyone has any reflections, questions, tidbits that they would like to add to all of the information that we just went through.
Hi, this is Kindy Oldschild. I already put my appreciation in the chat, but I just want to say again, flexibility was the one thing that I really wanted in WIC. I was so happy when you could trade out milk for cheese. It's amazing to see all the new stuff that's added, how much more flexible it is. It makes it so much easier to provide for your family and cook for your family and not feel like somebody's telling you what you need to do and what you need to have for them. And I just really love that it keeps evolving every time I look at it and that it was available. I don't know what I would have done without it.
Thank you, Kendi.
Heather, may I just say one more time to reinforce that, WIC is open. We are open to all families, just to make that clear, that meet the income guidelines in our Oregon residents. I know we get some questions like that, and just also assuring that we are a safe place to be. We keep your information and your data safe as well. And I just want to reemphasize that because I know those are concerns with families right now. Thanks, Heather.
I have a question for the presenters. If there was one thing that you would like to be common knowledge for people living in Oregon about WIC, what would it be? What's like your favorite fun fact, your like home run piece of information?
I think we're all waiting on each other. I would, for me, I'd say it's the reach, that it's, 40, a little less than 40% of all births in the state. I think people don't realize that, and that it's, it's not a teen program. We have teens, but that's not the majority of folks. It's adult working people, as Jolene has mentioned. So.
I'll add that we are a nutrition education program. And I feel like not a lot of folks know that. And just how valuable that is to new parents. And we provide a lot of breastfeeding support. We have international board certified lactation consultants. We have registered dietitians. So the amount of information that our participants are able to get for free, I think, is my favorite part of the program.
Those are so good. I will, yes, ditto all of that, and also say WIC is everywhere. We are in every county. Where there are about 100 sites throughout Oregon. We are in mostly in public health, but we are also in a few in nonprofits. We have a few Confederated Tribes WIC programs where there's a Umatilla Morrow. There's a Head Start program we're working with. We also have services through the Salute Medical centers, so a few of those. So we are all over, and in every county we're a little bit different. So yeah, that's what I wanted to add. And Mary Kay, glad you could join us.
Yeah. Oh, I would just also say that I feel like we have a real an approach about walking alongside with families. That we know that the journey in parenthood is challenging at times, and we're there to support families. We know that they're the experts on their own children, and we want to support them in their journey of successful feeding with their children and families.
Yeah, I don't know that I have much to add. I feel like everyone did such a nice job. But also, I think what's important is our flexibility. We're trying to meet participants where they're at. If that means for some counties, that means a home visit. For some counties, it means a remote appointment, a phone call. Yeah, so our flexibility as well.
Amazing. Thank you all for taking the time to kind of share those last uh, tidbits of wisdom. I always, we talk about the importance of listening to those who have lived experience. And I think that how complicated our systems are, how they've been set up, and how difficult they can be to navigate. It's always helpful to hear from the folks that are the ones helping the system operate when it comes to what are the most important pieces we need to know, and how can we continue to help take down those barriers for community members who are in need of these supports and these resources. And so I really appreciate you all taking the time to share those with us and wrap up our conversation today that way. I do want to pause for a moment, give Dolly her 1 minute. You can have more than 1 minute, but I want to make sure y'all hear this important announcement before we close out.
Yes. Hello and good afternoon. Thank you everyone for being here as always. Thank you to the WIC team. And kind of keeping in mode with flexibility, we are also going to be flexible, and I want to share a special edition public health modernization chat that we will be hosting on October the 16th, I believe. The same time, 11 to 12. This special edition modernization chat will be on the West Coast States Health Alliance. So, what I want to let you know is that we've got a doctor, Dr. Melissa Sutton, will be coming and answering questions. I know folks have questions about vaccines, like what is this alliance, what are they doing, etc. So we will be having a special edition modernization chat with Dr. Melissa Sutton on October the 16th. You will get a message via email. If you have other friends or colleagues that are also interested in this topic, feel free to invite them. LPHAs that are on the line, we would love you to share it with your other LPHA colleagues. Just to make sure that folks have access to this information and resource, we're trying to be flexible and provide some opportunities with Dr. Sutton. So that is my update. Stay tuned to your email, and I hope that you'll be able to join us on October the 16th.
Thank you, Dolly. And as always, you will receive a follow-up email from me with the slides that we went over today with our fabulous WIC folks, as well as links that were shared in the chat. There's a fun video we didn't get a chance to watch that I will make sure to include. And I will also make sure that the information about the October 16th special edition chat is shared. There's a registration link for that. So for folks who would like to sign up, all of that information with the recording will be coming your way. So echoing what Dolly said, to watch your email boxes, because that will be out soon. And that is all I have for this pre-lunch hour. So thank you all for joining. Please come back if you can on the 16th. And again, in the first Thursday in November, we're going to have our oral health team come and give a presentation. More information to come. And yeah, thanks for hanging with us today and learning all about WIC. This was great.